Hello, everyone. Welcome to NAPC Live in Five. My name is Laura Sherburn. I'm one of the national coaches on the National Neighbourhood Health Implementation Programme, working with NAPC, and I am delighted to be joined today by Andy. Andy, do you want to introduce yourself?
Hi, Laura. Thanks. I'm Andy Brooks. I'm a GP and I'm the clinical chair of NAPC.
Great. So we're here today to talk about the recently published national guidance and the Neighbourhood Health Framework. In a nutshell, Andy, can you tell us what it is that we need to know and what we need to do?
A few thoughts. There's certainly lots of national metrics in there. I think I counted about 20. Um, and it seems that there's a common percentage of 10% for all those kind of metrics. So if we forget one, assuming that it's probably 10%, seems like a good start with those metrics. And they cover all sorts of things. So health outcomes, access to general practice, planned care, urgent and emergency care, staff and patient satisfaction, and some locally determined metrics. As well as the metrics, it then sets out a little bit about the how these improvements might be made, things like population health management, reduction in bureaucracy, integrated neighbourhood teams. The NHS can't help itself, so there's some more targets in that bit, and also expanding community services. Then there's a little bit about some of the new organisational forms, those three-letter abbreviations we've been hearing about: single neighbourhood providers, multi-neighbourhood providers, and integrated health organisations. Not much more about those, although there is a separate document that's also been published about those. There's a little bit about how they might link together in future. Then there's something about the timescale, so things that people are being asked to do for next year, 26, 27, and then a little bit about the 2 years after that. Interesting enough, there's no more money attached to this. ICBs have been tasked with finding that, which I'm sure might be difficult for ICBs in the current financial climate and also the other staff changes they're having to make. So there is a lot in there. One of the things we have done is worked out a one-pager, which is currently on our website.
That sounds really helpful. So you've talked a bit about the content, what it contains. Have you got any thoughts on what this actually means in practice?
Good question. I was thinking about it in two ways. If I was a glass half empty person, I might look at the guides and think, this is a lot of top-down stuff, a lot of metric-driven transactional targets, a lot of disease focus on GP access when we know actually continuity is more important, at least to better care. I may say, oh, this is all there so that the community works better, so that hospital metrics improve. And I think you could say there's a risk of disintegration rather than integration. So that's my glass half empty view. However, if I got out of bed on the other side and my glass was half full, I might be saying, actually, there's something in here about local authorities and the voluntary community faith sector working with health to think about what a local population needs and for them to be able to determine that, alongside a focus on staff and patient satisfaction. Interesting enough, I think it would be better if it was the other way around and we think about patients as people rather than as patients and staff satisfaction, but they're both really important. And using those as really great foundations, I think could really help to move this agenda on. And it's something certainly we found at NAPC with the 16 sites that we've been helping with in the National Neighbourhood Health Improvement Programme. So there's probably something there about a real tension, this top down versus bottom up, getting the balance right between what our members have said, which is this population based approach, versus the reality of living in an NHS that does need some metrics. And at NAPC, we're really going to push the agenda around population health.
Yeah, that's great. And I think certainly in the sites that I've been working in, the impact of staff activation and patient activation really pushes the dial on some of the outcomes and the metrics that you talked about in your glass half empty version as well. And some of the best ways of doing that we've found is just to bring people together around the table, including all of the different sectors, particularly VCSE, and that really starts to make change. So yeah, definitely welcome that part of the guidance. Is there anything missing from the guidance in your view?
Another good question, Lauren. Sometimes these things take a bit of time to percolate, doesn't it? You're sort of
Definitely.
concentrating what's in there, then you have to take a step back and think what might be missing. I wonder one of the things that might not get as much attention as we would have liked to have seen is things around leadership development and organizational development. These changes are complex, requiring organizations to work differently, work together, staff working differently. It does recognize that in the guidance about staff working together differently, but how do we do that? That's going to require leadership, organizational development. It's one of the things that our members have also told us. So at NAPC, we're developing a leadership offer that's also people can find on our website to help people step through and learn and develop to deliver the kind of changes that this guidance wants us to help us to support to deliver for the population that we serve.
Yeah, I think that's absolutely crucial, fundamental, and again, reflects a lot of the conversations we've been having locally as well. So thanks very much, Andy. That's great. I think we will be having lots of discussions locally, regionally, and nationally over the next sort of a few weeks and months, and it'll be really interesting to see how some of this plays out. It'll be good to get back together with NAPC colleagues as the conversations move forward. Thanks very much for that.